In the previous video, we covered the bones of the neurocranium, the parts of the skull that protects the brain. But what about the bones that shape our face, hold our teeth, and form the structures of our nasal cavity and orbits? That's where the viscerocranium comes in. While the neurocranium safeguards our brain, the viscerocranium is responsible for everything we recognize in a person's face, from the curve of the cheekbone to the structures of the jaw. In this video, we will go through each of these facial bones, their key landmarks and their role in function and aesthetics. We will also look at how these bones interact to form openings and passageways for nerves, blood vessels, and sensory organs, all of which are critical for sight, smell, and taste. And in the next video, we will cover the joints and the sutures of the skull. Hey everyone, my name is Time. I'm a medical doctor and I make animated medical lectures to make different topics in medicine visually easier to understand. If you would like a PDF version or a quiz of this presentation, you can find it on my website along with organized video lectures to help with your studies. Alright, let's get started. As we said earlier, the bones of the skull are divided into two main systems, the neurocranium and the viscerocranium. The neurocranium consists of all the bones that enclose and protect the brain, which we covered in the last video. Now, let's shift our focus to the viscerocranium, which is highlighted here in green. These are the bones that shape the face and support crucial functions like chewing, speaking, and breathing. Let's go ahead and highlight them. We have the maxilla, the zygomatic bone, Palatine Bone, which we can't fully highlight yet because it's embedded within the skull, the Lacrimal Bone, Nasal Bone, Inferior nasal concha, Vomer, and the lower jaw or mandible. These are the bones we will be covering in this video, so let's start with the maxilla. The maxilla is also known as the upper jaw, and it's such an important bone in the viscerocranium. It is involved in forming the orbit, nose, and palate, holds the upper teeth, and plays an important role for chewing, speaking, and facial aesthetics. Let's break it down. The maxilla consists of a central body and four distinct processes that extend from it. The body of the maxilla is its core pyramidal structure, containing a hollow space called the maxillary sinus that plays a role in reducing the weight of the skull and humidifying the inhaled air. Superiorly, we have the frontal process, which extends up to articulate with the frontal bone. Laterally, we find the zygomatic process, which connects the maxilla to the zygomatic bone. Inferiorly, there's the alveolar process, which forms the upper dental arch and holds the upper teeth in place. Medially, if we look from an inferior perspective, we can see the palatine process, which contributes to forming the hard palate, or the roof of the oral cavity. For orientation, let's look at the maxilla in relation to other bones. Above is the frontal bone, laterally is the zygomatic bone, below the mandible. Then, forming the posterior part of the hard palate is the palatine bone. Dividing the nasal cavity is the vomer. We can see the pterygoid processes of the sphenoid bone extending downwards. And then, at the back is the occipital bone. Now that we have the big picture, let's dive deeper into the detailed landmarks of the maxilla. Here I've grayed out all the other bones so we can focus solely on the maxilla. This bone has several surfaces: the orbital surface, anterior surface, infratemporal surface, and the nasal surface. Below, we can see the palatine process of the hard palate and the alveolar process for orientation. Now, let's isolate the maxillary bone from an anterior view and then from an inferior view. Here I've highlighted some important structures. First up is the infraorbital margin, which marks the lower boundary of the orbital cavity. Just beside it, we can find the anterior lacrimal crest, a ridge that plays a role in forming the lacrimal fossae, containing the lacrimal sac. Think of it as the tear drainage system. Then there's a groove called the infraorbital groove. This groove leads to the infraorbital canal, which transmits the infraorbital nerve and vessels. These structures exit onto the face through the infraorbital foramen, providing blood supply and sensations to the mid-face region. We also have the canine fossa, which is a deep depression above the canine tooth, and the canine eminence, a bony ridge over the root of the canine tooth. Next, bordering the nasal cavity is a nasal notch, contributing to the pear-shaped opening of the nasal aperture. If we now rotate the maxilla in this direction to view the infratemporal surface, we will see the maxillary tuberosity, a rounded area behind the last smaller tooth. This region contains small openings called the alveolar foramina that allow the passage of the posterior superior alveolar nerves and vessels, supplying the upper molars. Turning the bone a little further in this direction, and we will see the nasal surface, forming part of the lateral wall of the nasal cavity. Here we can find the nasal crest, which articulate with the vomer to form the nasal septum. There's also the conchaeal crest, which articulates with the inferior nasal conchae, and the ethmoidal crest, which connects with the middle nasal conchae. The lacrimal notch here leads into the lacrimal groove, containing the nasolacrimal duct, which is our tear drainage pathway. So tears are produced by the lacrimal gland in the upper lateral part of the orbit. Then, when there's too much tears that overflows the eyes, some of those tears will make their way through the lacrimal notch and the lacrimal groove within the lacrimal duct to take the tears towards your nasal cavity. That is why the nose sometimes runs when tears are being produced. Additionally, we have the greater palatine groove, which runs posteriorly, transmitting the greater palatine nerve and vessels towards the palate. Now, let's talk about this large cavity within the maxilla, called the maxillary sinus. Sinuses are air-filled spaces that lighten the weight of the skull and helps humidify the air we breathe in. We have several sinuses in our head, and the maxillary sinus is one of them. It is the largest paranasal sinus and plays a role in voice resonance and reducing the skull weight. Now, let's look at the skull from an anterior perspective, then cut the skull like this, and look from this direction. We will be able to see the maxillary sinus and its opening, the maxillary hiatus. This opening allows the mucus to drain into the middle nasal meatus of the nasal cavity. Now, for orientation, we can see the inferior nasal conchae, middle nasal conchae, and between them is the middle nasal meatus, and below is the inferior nasal meatus. Let's now look at the maxilla from an inferior view again and highlight structures from this view. We can see the maxillary tuberosity and the greater palatine groove again. But we can also see the dental alveoli of the maxilla, or also known as the alveolar cavities. These are small spaces along the lower part of the maxilla that holds the root of the teeth, with their shape varying based on the type of tooth. In adults, there are normally 8 dental alveoli on each maxilla, giving a total of 16 dental alveoli found across the entire maxillary alveolar arch. 2 adjacent dental alveoli are separated from each other by interalveolar septae, and the dental alveoli for some teeth are subdivided by interradicular septae in order to accommodate teeth that have more than one root. Other things we can see are palatine grooves, which are 2 curved shallow depressions found along the palatine surface of the maxilla. They contain the greater palatine nerve and vessels and lead them towards the greater palatine canal. Then we can see the incisive canal, which is the canal that connects the nasal cavity with the oral cavity, and it transmits the nasopalatine nerve and branches of the sphenopalatine artery. So that was the maxilla. Next, let's do the zygomatic bone, which is also called our cheekbone. It consists of a lateral surface which forms the most prominent part of the cheeks and provide attachment for facial muscles, a frontal process which extends superiorly to articulate with the frontal bone, contributing to the lateral rim of the orbit, an orbital surface which form part of the inferior and lateral wall of the orbit, helping support the eye, and a temporal process which extend posteriorly to connect with the zygomatic process of the temporal bone to form the zygomatic arch. The zygomatic arch serves as the attachment site for the masseter muscle, one of the main muscles of mastication, which plays a crucial role in chewing by elevating the mandible. It also helps define the shape of the face. If you look at the skull from this view, we can also see the temporal surface, located posteriorly, which form part of the infratemporal fossae, a region that contains important structures like the maxillary artery and the pterygoid muscles. In this region, the zygomatic bone has 2 foramina, called the zygomatico-orbital foramina, which transmits the zygomatic nerve and accompanying vessels to innervate and supply the skin over the cheeks and temple. At the front, we can see the zygomatico-facial foramen, which allow the passage of the zygomatico-facial nerve and vessels to supply the skin over the prominence of the cheek. Now, if we go back to this view again and focus on the temporal surface, we can see the zygomatico-temporal foramen, which transmits the zygomatico-temporal nerve and vessels to supply the skin over the anterior temporal region. So that was the zygomatic bone. Next, we have the palatine bone. The palatine bone is interesting. This is an L-shaped bone located behind the palatine process of the maxilla. Let's now go ahead and isolate it. This L-shaped bone consists of a horizontal plate and a perpendicular plate. The horizontal plate forms the posterior part of the hard palate, while the perpendicular plate extends vertically and contribute to the lateral wall of the nasal cavity. Other parts we can see is the pyramidal process, which goes backwards and fits between the pterygoid plates of the sphenoid. We have the sphenoidal process, which articulates with the sphenoid bone, and the orbital process, which contributes to the floor of the orbit. To make it easier to orientate, it's important to remember these surfaces. The nasal surface faces the nasal cavity, palatine surface faces the oral cavity, maxillary surface articulates with the maxilla and contributes to the pterygopalatine fossae. Now, let's go over some landmarks. We have something called the nasal crest, where the vomer articulates to form the nasal septum. We have the conchal crest, where the inferior nasal conchae attaches, the etymodal crest, where the middle nasal conchae attaches, sphenopalatine notch, which is a gap at the superior border that, with the sphenoid bone, forms the sphenopalatine foramen, allowing passage for the sphenopalatine artery and nasopalatine nerve. Then we can see the greater palatine groove, which is a channel on the inferior surface that, when combined with the maxilla, forms the greater palatine canal, transmitting the greater palatine nerve and artery to the hard palate. Okay, let's now take the lacrimal bone, then smash together the contralateral lacrimal bone. This is what they look like, lying on the backside of our nasal cavity. Together, they form the nasal crest that has the posterior nasal spine. This is the dorsal projection of the nasal crest and forms the origin of the muscle of the uvula. And just to orientate, again, we can see the maxilla here and the sphenoid bone here. On the nasal crest, we can see the vomer. Laterally, we can see the inferior nasal conchae, middle nasal conchae, and the perpendicular plate up here. On the inferior side, we're looking at the hard palate now. Here we can see the lesser palatine foramina, which are small openings located near the posterior margin of the hard palate, transmitting the lesser palatine nerves and vessels. These nerves provide sensory innervations to the soft palate. Anterior to it, we can see the greater palatine foramina, which are larger openings positioned near the second or third molars. These foramina transmit the greater palatine nerves and vessels, which supply the hard palate mucosa, palatine gland, and the posterior palatine gingivae. So that was the palatine bone. Next, let's do the lacrimal bone, nasal, inferior conchae, and vomer. The lacrimal bones are the smallest and most fragile bones of the facial skeleton, each roughly the size of a fingernail. They are located in the medial wall of each orbit. Anterior to the etymodal bone, they articulate superiorly with the frontal bone and antero-inferiorly with the maxilla. Now, when you look at the lacrimal bone, you will immediately notice a groove, and this is called the lacrimal groove, which together with the maxilla form the lacrimal fossae. This fossae contains the lacrimal sac, which is an important component of the tear drainage system. So tears collect in the lacrimal sac and drain through the nasolacrimal duct into the inferior nasal meatus of the nasal cavity, explaining why excessive tears lead to a runny nose. The nasal bones are two small elongated bones that form the bridge of the nose. They articulate medially with each other at the internasal suture, superiorly with the frontal bone at the frontonasal suture, laterally with the frontal process of the maxilla, and posteriorly with the perpendicular plate of the etymodal bone. On the external surface, we can see a very small hole called the nasal foramen, which allows for the passage of small emissary veins. Otherwise, the nasal bone provides attachment for the processus and the nasalis muscles, which are involved in facial expression. On the internal surface, as we see here, we can find a groove called the etymodal groove for the anterior etymodal nerve, contributing to the innervation of the nasal mucosa. Then we have the inferior nasal conchae. These are independent bones that project from the lateral walls of the nasal cavity. They are distinct from the superior and middle nasal conchae, which are part of the etymodal bone. They are all covered by mucous membranes, and they all increase the surface area of the nasal cavity, enhancing the warming, humidification, and filtration of the inhaled air. They also play a role in directing the airflow and facilitating the drainage of the nasolacrimal duct into the nasal cavity. Then we have vomer. This is a singular bone that forms the posterior inferior portion of the nasal septum, separating the two nasal cavities. It articulates superiorly with the perpendicular plate of the etymodal bone, inferior-laterally with the maxilla and palatine bones, and superiorly with the sphenoid bone. So that was it for all of these bones. Now, let's cover the detailed anatomy of the lower jawbone. The mandible is the largest and strongest bone of the face. It consists of two parts mainly. We have the ramus of the mandible on either side and a horizontal body of the mandible. The ramus is the vertical extension on each side of the body. The first noticeable thing we can see is the prominent angle of the mandible. And if you look closely, you will find two processes on the superior part of the ramus. One called the coronoid process, which is a thin triangular eminence that serves as the insertion point for the temporalis muscle. And we can see the condylar process. This process consists of the head of the mandible, which articulates with the mandibular fossae of the temporal bone to form the temporomandibular joint, allowing movements essential for chewing and speaking. It consists of a neck of the mandible that supports the head and contain a fovea, which is a small depression on the anterior surface of the neck where the lateral pterygoid muscle inserts. Between the coronoid and the condylar processes is the mandibular notch, a concave area that allows passage for the masseteric nerve and vessels to the masseter muscle. Now, what else can we see here? The angle of the mandible is the area where the body and ramus meet, and on the outer edge, we can see the rough masseteric tuberosity, which provides an insertion point of the masseter muscle. Now, let's cover the structures associated with the body of the mandible. On the inferior side, we can see the rounded base of the mandible, which provides structural support and serves as an attachment for several muscles involved in jaw movement. Up here, we have the alveolar part, which contains the dental alveoli, containing the roots of the lower teeth. This part of the mandible is constantly remodeled throughout life in response to tooth eruptions and loss. Then we can see the mental foramen, a small but prominent opening located below the second premolar tooth on each side. This foramen transmits the mental nerve and mental vessels, which are responsible for sensory innervations of the skin of the lower lip, chin, and the labial gingivae of the mandibular incisors and canines. Let's now highlight some important landmarks. The first thing we notice is the mental protuberance, which is the bony prominence at the front of the mandible forming the chin. This is more pronounced in some individuals and contributes to the overall shape of the lower face. On either side of the mental protuberance, we can see the mental tubercles. These are small elevations that adds to the contour of the chin. Then we have the oblique line of the mandible, a ridge that runs from the mental foramen upwards towards the ramus. This serves as an attachment for the depressor anglioris and the depressor labii inferioris muscles, which help in moving the lower lip. In the midline, we can see the mandibular symphysis, which represents the fusion site of the two halves of the mandible during early development. Now, let's look at the mandible from the inside. Even here, we can see the mandibular symphysis extending along the entire midline of the mandible. Let's start with the landmarks from the midline and then continue outwards. The first thing we can see is the superior and inferior mental spines, or also called the genial tubercles, which serves as an attachment point for the genioglossus and the geniohyoid muscles. Those are two important muscles involved in tongue movement and swallowing. Moving laterally, we find the mylohyoid line. This is a ridge that runs obliquely along the inner surface of the mandible, which serves as an attachment for the mylohyoid muscle, a major muscle of the floor of the mouth that supports the tongue. Just above this line, there's the sublingual fossae, which provides space for the sublingual gland, and below the mylohyoid line, there's the submandibular fossae, which contains the submandibular gland, one of the 3 major salivary glands. On either side, we have the mylohyoid groove, which runs downwards and forward from the mandibular foramen and transmits the nerve to mylohyoid, a branch of the inferior alveolar nerve. Now, the mandibular foramen is a large opening on the inner surface of the ramus of the mandible, serving as the entry point of the inferior alveolar nerve, artery, and vein, which travel through the inferior canal to supply the lower teeth. Now, let's go ahead and add some muscles. Here we see the mylohyoid muscle attached to the mylohyoid line, but we can also see another muscle attaching to the inferior surface of the mandible near the midline. This attachment point is called the digastric fossae, and it serves as the origin for the anterior belly of the digastric muscle, which plays a role in depressing the mandible and elevating the hyoid bone during swallowing and speaking. So that was all of these bones. Now, lastly, this is debatable, but in some sources you might find that the hyoid bone is considered a part of the viscerocranium. So let's just go over the hyoid bone very quickly. The hyoid bone is a very unique bone. It floats beneath the mandible and is suspended by muscles and ligaments without directly articulating with any other bones. But it is so important because it stabilizes structures in the neck and provides a solid base for the tongue, larynx, and pharynx. It plays a role in swallowing, speech, and maintaining the airways by serving as an attachment point for a lot of muscles. As you can see here, many muscles attach to it. There are the suprahyoid muscles such as the mylohyoid, digastric, and the stylohyoid, which help elevate the hyoid bone and assist in swallowing. Then we have the infrahyoid muscles, including muscles like the thyrohyoid and the sternohyoid, which depresses the hyoid bone and stabilizes the larynx. Notice also how the hyoid bones sit directly above the larynx, or the voice box. This relation is crucial because movements of the hyoid bone directly affect the position of the larynx, which is important for phonation or speech. So let's go ahead and isolate this bone. The hyoid bone consists of 3 main parts. First is the body of the hyoid bone, which is the central position providing attachment for the geniohyoid, mylohyoid, and the sternohyoid muscles. Then we have the greater horns, which goes posteriorly and slightly upwards, serving as attachment sites for muscles like the hyoglossus and thyrohyoid. Lastly, we have the lesser horns, which are thin, tiny projections near the junction of the body and greater horns. These act as attachment points for the stylohyoid ligaments, which suspends the hyoid bone from the styloid process of the temporal bone. Alright, we finally managed to go through the detailed anatomy of all the bones of the viscerocranium. In the next video, we will look at all the joints of the skull and cover the sutures as well. If you want handmade PDF versions of this lecture, take a quiz to test your knowledge, or access an organized list of all my videos, you can find everything on my website. Thank you so much for watching another one of my videos. If you enjoyed it or learned something new, don't forget to like, comment your favorite moment, and subscribe. Turn on those notifications so you never miss a video. If you're looking for other ways to support, check out the links in the description. Have fun y'all, peace.